our last man. You met her before. Now take a look at why Kelly was in desperate need of our help.
This is what it's like sleeping at my house. My husband snores all night, every night. Do you hear this? Snoring, snoring, always snoring. It is so loud and annoying. I can't sleep. The kids can't sleep. Do you hear this? We are so tired. Regis and Kelly, please fix my man. And our dad.
There you go.
Yeah, we were saying, you see, you put the pillow over the wrong face. It goes over his face. Anyway, just kidding, Scott. We sent Scott to top ear, nose, and throat specialist, Dr. Charles Kimmelman, hoping he'd lose the nighttime noise. But let me warn you, this video is not for the squeamish. So if you are squeamish, look away. Shut your eyes.
So, Scott, what can we do for you today?
Hopefully we can fix my snoring.
And what's the snoring like?
It sounds like a deep rumble or grumble, and it's really loud.
Does he ever seem to stop breathing?
Because the snoring wakes me up, I can sometimes hear him quit breathing. And it's not often, but it is sometimes.
Have you done anything on your own to help the snoring?
Oh, we've tried different self-remedies, allergy medications, different pillows, the nose strips, and nothing works.
Okay, so now let's have you sit in the chair and take a look and see what things look like on the inside. Now I'm going to go get my endoscope, which is an instrument that goes in the nose, down the way the air goes into the throat, so we can look at the lower portions, the back of the tongue, and the area of the voice box. Breathe in. Breathe in again. It looks from this examination that you are an excellent candidate for the pillar procedure. These are the implant devices. Looks like a kind of a toy gun, and the implant is inside. So this is sterile. And I'm going to take these out of the carton and get them ready. And as soon as things are numb, then we'll start. Scott, what I'm going to do now is numb up the inside of your throat with a needle. Now here's a little needle stick. While you're waiting for it to get numb, here's what the implant itself looks like. I'm going to put 4 of these in your palate. And are you ready to get started?
Yes.
Okay, let's go.
All right.
I'm going to push down on your tongue a little bit. Well done, Scott. Okay, Scott, you should be starting to have less snoring in a few weeks, and it will get better and better as time goes on.
Thank you, Dr. Kimmelman.
You're welcome.
I can't wait. I can't wait to see if that helped him, if that was all worth it. And we're going to talk to Kelly and Scott when we come back.
And the doctor.
And the doctor. In a moment. Okay, we got everybody here, as you can see, Kelly and Scott Higginbotham, and Dr. Charles Kimmelman. Nice to have you here. Well, first of all, Scott, how are you feeling?
Doing well right now. Tuesday night and Wednesday morning were a little iffy, a little sore.
Like what? In the throat?
Yeah, in the top of the mouth, obviously, where he was doing the procedure. But it was a little sore. But give it 24 hours.
I've got to tell you, I'm not squeamish at all, and even I sort of reacted to that procedure. Is that a common procedure, doctor?
Yes, a lot of doctors do it. I'm one of the first to have done it in the country, though.
Now, what exactly are you doing? It's called a pillar procedure.
Right.
And you're injecting him with?
These are small implants made from a polyester material.
Right.
This is what it looks like. I don't know if you can see it.
Yeah.
So tiny.
But it's tiny. It's 18 millimeters long.
And what does that do?
And it supports the palate, just like my collar stay does my collar.
So it gives the whole area more room to breathe and less to snore?
Exactly. More support so it doesn't flop and also gets sucked back into the throat.
So you said he was a candidate when you looked in there. And
That's correct.
Right.
Right.
You could see why, how this would work on him.
Exactly. The shape of the tissues, the size of his back of the tongue, and so on. All of this is part of the
and we saw it all on the tape we just took a look at.
Yeah, but
right?
I couldn't tell you to save my life what I was looking at.
Yeah.
Well, that was the inside of his mouth, the roof of the mouth, and the device that puts them in is like a little toy gun, and it's preloaded with the implant, and it shoots it in.
Shoot it right in there. Did you feel that when it came in? Being shot in the mouth.
Well,
do you hear what happened to you?
He had numbed me to begin with, but I could still feel the pressure.
It, right?
Well, the big question is, when are we going to see the results?
Well, it does take a little while to work. It takes anywhere from 6 weeks to 6 months.
Oh, no kidding.
But it's worth it. It's worth it.
For this so far?
Yes, 70%.
Wow.
70%.
Yes.
Okay.
That's a great success rate. I mean,
Well, I guess
snoring
what we should do is have Kelly and Scott back, right? In a few months?
Yeah.
How long should we wait, Doctor?
Well, you got to wait about three months at least.
3 months at least.
And sometimes it takes a little
And we'll
longer.
come back with a camera and we'll see. All right.
Yeah.
Well,
And Scott, good for you for enduring the procedure.
and thank you, Dr. Kimmelman, very, very much. Tom Felton from